I'm Beth Darnall. I'm a clinical associate professor at Stanford University in the Division of Pain Medicine, and I'm a pain psychologist. So there have been a lot of developments in 2016 around guidelines and policy. Earlier in 2016, the CDC issued guidelines for prescribing opioids for chronic pain. And the main takeaways from the CDC guidelines were a recommendation to minimize use of opioids, in particular for chronic pain. And this was based on data from multiple different studies that appeared to show that in aggregate, opioids are not effective treatment for long-term pain. So physicians have prescribing discretion, but the overarching recommendation is to minimize opioids for chronic pain. Simultaneously, in the same week, it received less attention, but the National Pain Strategy was issued by Health and Human Services in the government, and this is a blueprint for where the country needs to go to address the pain crisis and needs of people living with chronic pain. And the National Pain Strategy does emphasize the need for self-management programs around the country and for the integration of behavioral medicine, or what we call pain psychology, into the treatment of pain. So at Stanford University, we do include recommendations from the National Pain Strategy. So we include self-management classes and approaches into our patient care. We offer a multitude of different behavioral medicine, pain psychology classes that serve to provide patients with education that's needed to acquire skills to better manage pain. These are skills that facilitate self-modulation of the experience of pain. And with those skills, patients gain better control of their own experience so that they need fewer medical visits and fewer pharmaceuticals or fewer treatments. So it's not one or the other, but what's really needed is an integrated approach. And that's one of the goals and the approaches at Stanford, is to provide a comprehensive, integrative approach to pain care. Increasingly, centers around the country are emphasizing non-pharmacological treatment strategies into the approach for chronic pain care. So now, with a minimal emphasis on opioids going forward, there's been a lot of press around, well, how are we going to treat pain differently? If we're not using opioids, what are we going to do? So there's been more of an emphasis on evidence-based treatments, such as mindfulness-based stress reduction, such as cognitive behavioral therapy, such as self-management approaches. These are all evidence-based treatments. So there are a multitude of programs in the United States that have done great with integrating these into treatment plans. But really what's needed at the national level is better training for these types of approaches, large-scale systems, so that patients can fully access these non-pharmacological strategies or these behavioral strategies no matter where they live in the country. Because as it is now, there's only a select few centers where patients can access this care.